disease. So what is Crohn's disease? Crohn's disease is a disease of the bowel and or the small intestine, or both. There is inflammation in the digestive tract which leads to multiple different symptoms. There is not one specific cause that leads to developing this particular disease. Two different causes can be linked to the immune system and heredity. Some bacteria can make you develop this disease, but not one specific bacteria will trigger this disease. Crohn's affects every layer of the digestive tract lining depending on how severe you develop this disease. Where there's inflammation in the intestines, the inflammation will speed up your metabolism, making you lose weight, and it's harder for Crohn's patients to keep the weight on. Crohn's can be identified as an autoimmune disease. And an autoimmune disease is when the body attacks itself thinking that it is a pathogen when it is not. One cause of inflammation can be caused by a protein called TNF-alpha, which is made in our bodies, but too much of this protein leads directly to inflammation. Your digestive tract begins at the mouth and ends at the anus. The wall of the small intestine consists of circular plicae, which is where villi comes into play. Villi and microvilli are in the intestines for absorption of nutrients. Between villi are intestinal crypts where cells are made in order to replace old cells to make the new ones and to keep the intestinal mucosa having new cells. The intestinal walls consist of serosa, muscularis, submucosa, and mucosa. Now moving into the large intestine, it only has microvilli. The layers inside the colon is mucosa, submucosa, the muscular layer, and serosa. The mucosa secretes digestive juices and aids in the absorption of nutrients that we take in. The mucosa is the second layer that has a dense layer of connective tissue, blood vessels, lymphatic vessels, and nerves. The large intestine also has longitudinal muscles as well as circular muscles. With that being said, Crohn's disease inflames the crypts and in turn causes ulcers. So you can see right here, these are the singular villi, and between each villi, there's a crypt. So in Crohn's patients, ulcers develop in these crypts. Having mucosal damage, the body cannot secrete digestive juices and reabsorb the nutrients the body is taking in. When there is mucosal damage with Crohn's, there is damaging of the intestinal villi. That means the body cannot absorb the nutrients you are taking in. Regardless of what Crohn's patients eat and take in, the body, because the villi are affected, cannot absorb the nutrients properly. Because the body cannot absorb the nutrients properly, the body cannot have substantial amounts of iron, protein, and other minerals, which in turn can lead to other health conditions. This is why doctors recommend Crohn's patients to take supplements in order to keep the weight on and to keep their health be as healthy as they can be, pretty much. Diarrhea is one of the main symptoms of Crohn's. And when you have diarrhea, it occurs in the cells in the digestive tract become irritated. And in this case, Crohn's causes inflammation of the GI tract. So when the food is passed through the small intestine, the villi and microvilli are not taking in the nutrients, and it is just going straight through the intestines, and the body cannot retain anything that Crohn's patients eat in general. So Crohn's can happen to anyone of any age, and this is my citations for my two pictures on the slide before this one.